Hello, today I am going to represent one of my research article, that is COVID-19 during the lockdown period in India, a time series forecasting. In this article, I actually try to represent the forecasting, and in my previous research article, there was a statistical analysis, and here I like to mention is that in case of in case of in case of coronavirus disease, in case of coronavirus disease, COVID-19 is an infectious disease. It is known to all of you, and it is caused by a newly discovered coronavirus. Most people infected with the COVID-19 virus and will experience mild to moderate respiratory illness. Here, one thing should be mentioned is that the most of the cases are experiencing mild respiratory mild respiratory problem, and those cases which are suffering more moderate respiratory illness are there. They are those persons who have cardiovascular disease, diabetes, chronic respiratory disease, and cancer. So we can say that on the basis of the World Health Organization, the COVID-19 virus will experience a mild to moderate respiratory illness and recover without requiring special treatment. Older people and those with the underlying medical problems likely to develop serious illness. The best way, as far as the WHO is concerned, the best way to prevent and slow down transmission is be well informed about the COVID-19 virus, the disease it causes, and how it spreads. Protect yourself and others from infection by washing your hands or using an alcohol-based rub frequently, and of course, not touching your face. So, in this research article, I try to present a time series analysis with a statistical presentation, and also there is a forecasting. On 24th March 2020, the government of India, under the Prime Minister order, a nationwide lockdown as a preventive measure against the COVID-19 pandemic in India was taken. And we are passing the lockdown periods. So my article, the data has been collected in this lockdown period. And for my research work, I have collected data from official website. The website is given in the slide and you can find it. And the data period is 5th May 2020 to 30th May 2020. Now, this is a graphical presentation of the corona active cases at the level data. And along the horizontal axis, we measure, this is the horizontal axis. Okay, this is the horizontal axis. Along the horizontal axis, we measure the time period, and along the vertical axis, we measure the corona active cases at level data. So if you have a closer look in this pictorial presentation, then you can have the line has a upward rising tendency. So it is much more clear that the corona active cases at level data has been increasing. Level data have been increasing in our country day by day. Okay, now if you look this, now look along this vertical axis, along the vertical axis we measure the growth rate, and along the horizontal axis we measure the date. So this pictorial presentation actually represent the growth rate of corona patients during the period of my study, that is the 5th May to 30th May 2020. And if you have a closer look in this graphical presentation, then you can find that the growth rate of corona patient during the period of my study, is decreasing. It has a declining trend. Okay. So growth rate has a declining tendency. It should be noted. Now look, this is the recovery rate. This is the recovery rate over my study, and you can find here that in the same way we along the horizontal axis we measure the time, and along the vertical axis we measure the recovery cases. So you can find that over the period there is a tendency of increasing the recovery rate. There is a tendency. Recovery has been increasing day by day. So it is a good news for us. Okay. Now this is a graphical presentation of the corona active cases, and you can find from this figure that along the horizontal axis we measure the states, and along the vertical axis we measure the active cases. So it is clear from this pictorial presentation that there is a huge spike. And this spike belongs to Maharashtra. Okay, so Maharashtra in active cases are huge in Maharashtra, and there is Delhi, whose active cases is near about 10,000, and also there is Tamil Nadu, whose active cases is near about 10,000. But other states do have less than 5,000 active cases till today. Okay, so this is the graphical presentation of the active cases over my period of study. Now I am erasing all this marking. Now look, this is the graphical presentation of cured cases or of discharged cases, and you can find there is a huge spike. There is also a huge spike in case of Maharashtra. Maharashtra recovery, the cured case or discharged case is more than 25,000. And in Tamil Nadu it is more than 10,000, and in Gujarat it is near about 10,000, and in Delhi it is near about 8,000. So cured and as far as the cured and discharged cases are concerned, that this pictorial presentation have a clear idea over this matter. Now I am erasing. Now look, this is the active cases. Cured cases, death, and total confirmed cases. Okay, total confirmed cases. So if you have a closer look, then you can find in case of Maharashtra, the total confirmed cases is huge. It is more than 60,000. It is more than 60,000. And and yes, and irrespective of this, and there is active cases more than 30,000. In Maharashtra, active cases is more than 30,000. And and cured cases is near about 30,000. So in case of Maharashtra, what is the active cases? What is the cured cases? And total confirmed cases you can find easily through this pictorial presentation, through this bar diagram. Okay. Now in case of Gujarat, you can find also this. In case of Gujarat, the total confirmed cases is near about 18,000, near about 18,000. And in case of Delhi, the total confirmed cases is near about 19,000, 19, near about 19,000. In case of Tamil Nadu, you can find the total confirmed cases is near is 20,000, is 20,000. So here we have a pictorial presentation where we present the active cases, cured cases, and total confirmed cases all together in a picture. So you can have a clear idea over the corona active cases over the COVID-19 in our country. Now look, this is the here we have a regression equation. And in this regression equation, I got this regression equation on the basis of the autoregressive integrated moving average. Maintaining the steps, I have got this regression equation, and this regression equation is statistically significant, and the results is given in this equation. Now, what is the yt and what is the yt minus 1? You should have a clear idea over these two variables. And yt is the dependent variable and yt minus 1 is the independent variable here. It means that how much the yt is affected by the yt minus 1. So here you can have a the total confirmed cases. Yt is the total confirmed cases. Total confirmed cases at period suppose 25th May. And this is, and yt minus 1, and yt minus 1 represents the total confirmed cases, but one period before. Total confirmed cases. So yt is independent variable total confirmed cases, and it is the total confirmed cases one period before. So here the coefficient is 0.56. That is, the total confirmed cases one period before is responsible for today's total confirmed cases. And here is a sign is positive, so it has a positive effect on this. It have a positive effect on this. Okay. Now, and this is the procedure. The data is generating data here, the total confirmed cases, this data is generating through this regression equation. Okay. Now this is the forecasting with the level data. So it is by using the autoregressive moving average technique, and I have found that my forecasting is almost same with the level data. The forecasting is from this pictorial presentation. It is clear that my forecasting is very good. Okay, very good. It is similar with the level data. Red line represents the forecasting of the corona active cases, and a blue line represents the corona active cases at level data. Okay, now this is my my forecasting corona active cases from 31st May to 30th June, near about 1 month. You can have that on 31st May, there is near about 187 active corona active cases, total corona active cases in our country in 31st May. In 31st May, it is near about 1,87 to 88,000 cases are there. And you can find on 12th June, it is near about 2,50,000. And in 16th June, it crossed the 2,50,000. And in this way, we can have a clear idea on the basis of my forecasting is that on 30th June, it is near about 4 lakhs. Near about 4 lakhs, 3,90,000, near about 3,90,000 total active cases will be in our country. So, here from it is clear from this picture that our corona active cases are increasing, and after 1 month, it will be near about 4 lakhs. Okay. Now, this is the time plot of corona affected persons who have no physical contacts with the other Indians. The time plot of corona affected persons who have no physical contacts with the other Indians. Look at this here. Also, you can find that the data has a clear downward tendency. So this represents that over the period, the corona affected persons who have no physical contact with other persons have a declining tendency. Okay, have a declining tendency. Now the corona active cases, the forecasting. This is the forecasting on the basis of my previous slide, that here is a tendency. Here is a tendency of increasing. Okay. Tendency of increasing on 30th June, it would be near about 4 lakhs. Near about 4 lakhs. This line represents the 4 lakh. It is near about 4 lakhs on 30th June 2020. Now, so it is clear from my presentation that there is a tendency of the corona active cases, total corona active cases, to increase in future days. But there is a good news in this respect, that the most of the cases in India are experiencing mild illness, most of the cases. So except some critical cases. And this also be taken care. And to keep all our citizens in good condition, we should have to maintain some steps for our better life, to keep our country in good position and to fight with the coronavirus. We should maintain some steps, and this is the physical distancing. We should maintain it. We should maintain it, and from our core of our heart, and we should understand it. We should understand it. Otherwise it will be very difficult for our citizens who are mm, who mm, who are suffering from chronic diseases such as diabetes, hypertension, and such as the cardiovascular disease, and and cancer. This type of patients will be suffer. So for those patients, so for those people who are suffering, we should maintain the physical distancings for their better life. We should maintain it, and we also use marks. We also use marks. So using marks is necessary. Using marks is necessary. Now, washing your hands frequently, it is also necessary for your health, for your for the member of your family, and also for each and every citizens of our country. It is necessary to wash your hands frequently. Now, and 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 there is a also the economy, it is also a matter of concern. So we should do the necessary work, and we should do the necessary work, and that help build our economy. So I hope that you could understand this lecture. And in this lecture, I try to present the statistical presentation as well as the time series analysis with forecasting. And I have near about 1 month forecasting, and mm, and and some necessary steps I have mentioned. You should maintain, and hope I you enjoyed this lecture and enrich your knowledge thereby. And thank you for enjoying my lecture. Thank you.